Welcome, everyone, to Mondays with Michael. So good to be with you. Welcome, whatever platform you're watching us on live, whether it's on our watch page at michaelgaeta.com/watch or any of the streaming platforms that we are appearing on. We'd love to hear from you. If you'd like to let us know where you are and where you're calling from, anything you want to share, any articles, updates, videos, anything interesting related to our subject of this show, which is natural health and health freedom. We'd love to hear from you, so don't be shy. You can check in, share anything you'd like to share with the group, and also ask any questions you have. The questions we will be on our watch page or our Zoom link. Those are the two ways that we can receive your questions. But anything you'd like to share with the community, you can do that on any of our streaming platforms. And we'd love to hear from you. Thanks for being with us today. Always a pleasure to be with you. It's certainly a highlight of my week, and I'm really glad to be with you today. So we have a wonderful show for you today, and really honored to have a conversation today with an esteemed colleague. We've known each other for many years, and he has done an amazing work. And first, I wanted to, before I introduce him, wanted to let folks know what we're about here. And if you haven't been with us before, a warm welcome. If you've been with us a lot over the last 5.5 years, welcome back. It's great to see some familiar names in the chat here, and also some new friends as well. So welcome all. This is an offering of the Gaeta Institute, and our motto here, as with the Clinic for Chinese and Functional Medicine, is nature first, drugs last. As always, drugs aren't bad, they're just massively overused, and there's a natural solution to anything pharmaceutical, at least conservatively, 95% of the time. And so we are about two subjects here on Mondays with Michael, our podcast on natural health and health freedom. Those are our two subjects. Welcome to show number 288 for this November 3rd, 2025. And just delighted to be welcoming a wonderful guest today, who I'll introduce in a moment. As always, any questions you have, anything you'd like to share with the community, don't be shy. Just jump on in and put that right into the chat on our watch page or on our Zoom link. And we'd love to interact with you and engage in that way. So welcome, a warm welcome to Dr. David Kamnitzer. David is an esteemed colleague in the natural health field. Our topic today, which I'm really looking forward to, is the full harvest, paying it forward, powerful gems from 50 years in the healing arts. And Dr. David is a holistic chiropractor. He is an author of a book I'm really interested in, Why Are Your Hormones Moaning? There's an engaging title for you. A holistic guide to bioidentical hormones, emotional balance, and getting your life back. Dr. David is a healer, coach, spiritual guide, and contemporary mystic. You can find out lots more at his website, davidkabnitzer.com. And just an announcement, we're very excited to be having a brand new course that we have that's starting today. Is a brand new course that I'm teaching, how to prevent COVID injection carnage, or COVAX carnage as I abbreviate it, and how to build a winter-ready immune system. This is going to be a 3-class course that starts today. You can find out all about it, and not too late to join us at michaelgaeta.com. And this is going to be a wonderful course. I felt really compelled not just to share very effective ways to stay healthy in a cold and flu season, have a strong immune system throughout the year, but also to prevent, it's just been a total catastrophe by design, of COVID injection injuries. The estimates now are that at least 20 million have been killed by these injections. The number injured, estimates are perhaps between 500 million and 1 billion people worldwide injured but not killed. So this has been a total catastrophe, again, by design. And the good news is there's a lot we can do for ourselves and those we care about, family, friends, patients, to prevent COVID jab, what I call the genocide jab injury. It's not a guarantee, but certainly there's quite a bit that I've found very effective in practice to help patients stay well who have received one of these catastrophic murder weapons. And we're going to be talking about that as well as the immune system over the next 3 weeks, starting today. So this is a brand new course. Starts today, goes on for 3 weeks. Really encourage you to join us. It's going to be a wonderful course and going to be taking questions that you have about the immune system and the COVID injections. We're going to be looking at some of the current research on this subject as well. And it's, none of it is good news, but the good news is how good it can be and how much we can do to make a positive difference in people's lives. So, Dr. David Kamnitzer is a practical visionary and contemporary mystic, helping people integrate wisdom into action and creating lasting shifts in both how life feels and how life works. He also has advanced training in bioidentical hormone optimization with Dr. Neil Ruzier, and he combines his gifts in teaching and coaching, natural healing, energetic sensitivity, and deep knowledge of hormone optimization to empower people from all over the world via Zoom. He also sees people in person in his clinic in San Jose, California. He is a chiropractor who graduated at the top of his class from Palmer College West in 1987. He's been in practice for 38 years. Again, more on him at davidkamnitzer.com. So, whatever platform you're watching us on, folks, please let's give a warm Mondays with Michael welcome to Dr. David Kamnitzer. David, so good to see you, my friend.
Good to be here. Thanks. I'm looking forward to a dynamic and very useful conversation for your tribe
Yes.
here.
Yes.
One thing I wanted to ask you to kind
Please.
of calibrate my speaking today
Absolutely.
is, do you have an idea of what percentage of your audience are lay people and what percentage are health professionals?
It's certainly a mix. I
Okay.
don't have an exact percentage because we're on so many different platforms. We don't really know exactly who's attending, but just even in our Zoom link, which is a small part of our total audience, we have at least 3 practitioners here, which is about half. And I'm not sure what the percentage is otherwise, but it's definitely a mix of
Okay.
health conscious people and practicing clinicians like you and I.
I'll keep that in mind.
Thank you. So, David, so good to be with you. Thank you for the time today. And for folks who are less familiar with you and your work, if you could just give us a sense of a bit of your path and how you came to be doing this very broad work from clinical treatment to depth of a person's being, fulfilling their life purpose and destiny, and manifesting in a way which is a blessing to others. Just how did you come to be doing this work?
Okay, well, great question. And to do that answer justice, this could be a long answer. And
For
so
sure.
feel free to interrupt me if you
Yeah.
want to take me somewhere else.
Well, just to get started, because I know we have a lot to talk about today, sharing your many years of clinical experience. And before we get into those specifics, that full harvest of paying it forward, wanted to just give folks a sense of your path and how
Okay.
you came to be doing this work a bit.
So feel free to speed me along if I'm going too long.
Sure.
So I was born to two Western European intellectual people
Hmm.
in Los Angeles. Uh, and I was the firstborn of two boys,
Hmm.
and I was born in the mid 50s. And I was always a very sensitive child. In fact, this world was very jarring to me. I was actually partially cross-eyed for the first almost 3 years of my life.
Hmm.
I I wasn't really used to as a soul. I wasn't really that used to these particular energies. And
Hmm.
fortunately, we had a conservative pediatrician that did not do surgery on my eyes.
Oh,
And right about the time I was maybe 3 years old, it spontaneously went away
oh,
as I familiarized myself with my environment more and more and became a little more familiar with it.
hmm.
So I didn't have any words at all during my childhood or adolescence to really appreciate who I was and why I was here and what I was going through or why I was going through it. But
Hmm.
what I did know from an early age, even though I didn't have the words I'm going to be using now
Yes.
to describe it, so I was going blind. I was
Oh,
going just by my being, but without any cognitive context
hmm.
or frame of reference.
Hmm.
Um, I I noticed that I enjoyed the company of adults a lot more than I did most children. I was
Hmm.
paying attention to different things,
Yep.
and I now I realize now that I was an empath, but I didn't know that at the time.
Oh, okay.
I didn't know anything about real healing because all my
Yes.
parents knew was Western medicine as it was practiced at that time. So I
Hmm.
had no ambitions at all of an interest in becoming a doctor at
Yes.
the time as a young person. But
Yes.
I was always very interested uh, in understanding things, in
Hmm.
learning things. I didn't have these words at the time, but I realize now that I had a passion for understanding something if I was interested in it, not if I wasn't, but if I
Right.
was, I always had a passion for understanding things all the way down to the first principles,
Huh. Okay.
to the
So
root.
a depth of curiosity.
Very much so.
Yeah.
And always feeling a little out of phase
Hmm.
with with people and with society who didn't seem to share my passion for,
Okay.
for that level of understanding. And so
Right.
I was really a dedicated student from the very beginning in that
Right.
sense of the word. And uh, I I also had a natural gift for being sensitive to how when I would learn something
Right.
from the beginning to really understanding it, I really paid attention at some level to how I learned that.
Oh,
And
so
so
learning to learn.
I ended up, so it turned out that even as a young child, I had a natural gift for teaching
Hmm.
because I knew how I learned. And
Hmm.
I learned where I could have gotten tripped up or where I did get tripped up. And that was spontaneously recognized by some of my teachers by the time I
Hmm.
was 9 or 10 years old. They would spontaneously ask me to help some of the children who were not learning as fast.
Interesting.
And so I knew from a young age that I had a love and a gift for teaching and how much I enjoyed learning something at a deep level and then passing it on to people at
Right.
whatever level they were interested in learning it. And so
Okay.
uh, I'm really at that level, I'm really a student and a teacher at heart.
Hmm.
And so um, to make a long story short,
Sure.
my interests led me into, at a fairly young age, doing a pretty deep dive into psychology
Hmm.
because I wanted to understand myself better, but I also wanted to understand these other humans who were
Hmm.
around me who definitely were beating to a little bit of a different drum
Right.
than
Right.
I was.
Right.
And so um, when I look back on it now, there were two really burning questions in my soul that kind of was the fire
Hmm.
that guided my life, I would say, up until about my mid 30s.
Okay.
And that was one was, well, gee, if there really is a loving God and
Right.
creator,
Yep.
and we are made in that image, and our Creator really loves us
Yes.
and wants us to have a great life. How come there's so much suffering in the
Mm,
world? And
great
then
question.
and then a corollary to that was, how come some people seem so healthy, happy, and successful?
Right.
And how come other people seem so unhealthy, unhappy, and
Oh,
unsuccessful? So, in my
okay.
own way, I was asking the universe, what are the laws of God? What are the laws of creation?
Mm,
And what is our role of free will in that game?
wow.
But of course, I didn't have any language of this at all. This is just sort of this was sort of the uh, energetic and metaphysical water that I was swimming in.
Right.
And um, and that took me on some interesting journeys in terms of depth of understanding in the realm of spirituality and psychology and metaphysics.
Mm,
And then I got to a point where I realized that if I wanted to understand myself, if I wanted to understand human beings and what made them tick, why they said what they said, why they didn't say what they didn't say,
right.
what they did, why they didn't do what they didn't do, what they were moved, what where they tended to put their attention, what they were blind
Yes.
to, all that stuff, that I realized that I had a big blind spot in my knowledge of humans.
Hmm.
And that was a blind spot in my knowledge of the physical body,
Hmm.
how the physical body relates to these other domains, which I already had a fair amount of facility with. And so it was within the frame of that question that my life started to draw me to healers,
Hmm.
uh, Rolfers, uh, acupressurists,
Right.
uh, nutritionists that have been trained by, influenced by standard process.
Yes.
So along those lines, I started when I was about maybe 21. I took a couple of classes in Jin Do
Oh,
acupressure.
wonderful.
And what I realized at the time, because I had no knowledge that I had any healing gifts at the time, what I found out when I was taking these acupressure classes
Yes.
was that the teacher would give us a chart to where the acupuncture points were, and
Right.
then the students had to find them.
Yeah.
And I could tell the difference between when I was on the point and when I was off the point.
From your sense of touch?
Right.
Oh, that's wonderful.
And
Well,
so
I have
I
to
had
say,
no idea until that moment that I had that energetic sensitivity.
yes.
And so
Oh, that's
later on,
wonderful.
I had other experiences that validated that.
Yeah.
I had some intensive study with a medical doctor who, in his later life, was diagnosed with terminal pancreatic cancer
Hmm.
and had a childhood background in metaphysics. And his
Hmm.
higher self started guiding him, and
Oh, wow.
he ended up healing himself and through many energetic means. And then he ended up teaching healers how to sense the different chakras and how to
Hmm.
work with them.
Who
And
is that?
that came very easy to me. And then
And
I
who was
apprenticed
that? Do
Brew
you
Joy,
remember?
Brew
Who's
Joy,
that?
Brew Brugh Joy, Joy,
Okay.
prominent internist in Los Angeles, passed away
Hmm.
fairly recently. Anyway,
Okay.
then
Well, David, I just want to point out, I mean, just from what I'm hearing, it's an amazing story. And it seems that there's some connection between your early life vision challenges that you overcame to opening up spiritual vision or opening up other layers or levels of perception, um, related perhaps to that early experience of like physical vision challenges that you overcame, that perhaps somehow that facilitated your opening of your perception to other levels
it could
of
be.
reality.
It could be. My hunch is that it's the other way around. My hunch is
Hmm.
that I did come in with this sensitivity and just
Okay.
being able to confront the frequencies of the physical plane at that time
Yes.
was very challenging, but it could be.
Well, at least related in some way,
Yeah.
because you spoke about this just natural, innate curiosity of asking meaningful questions, seeking deeper meaning, perceiving things in an expanded way, that it just seems
Yeah,
perhaps in some way,
could be.
related to
One
that.
one of the things when I look back on my childhood that I find very interesting
Yeah.
was that I had this pre-verbal certainty, both that I had a right to and that I would eventually have powerful, accurate answers to important questions,
Hmm.
which I took for granted at the time.
Okay.
In fact, it was shocking to me. I've had
Hmm.
many shocks in my life, as you might imagine.
Yes. Yes. Yes,
Uh,
indeed.
uh, Many disillusioning shocks, but
Hmm.
one of them was when I went to college
Hmm.
because I had this idea in my mind that when I went to college, I would finally find a lot of other people
Hmm.
who who had this passion for truth, who had this passion for deep inquiry, and I was disillusioned very rapidly. And
Okay.
um, so that was quite a shock.
Yep.
And so when I started studying the physical body, I studied it both from an experiential point of view, but also I started studying it. I started taking anatomy and physiology and
Right.
eventually chemistry, biochemistry, physics, and
Right.
struck me because of my psycho-spiritual context that I came into it with was when I was studying the human body and how it
Right.
worked.
Right.
To me, the idea that that could possibly be random,
Hmm.
that design and function of the body, was
Yes.
the most preposterous idea that I'd ever heard of. And
Right.
I became 100% certain that whatever divine intelligence was moving the planets,
Yes.
whatever divine intelligence was beating my heart when I was asleep,
Right.
whatever divine intelligence was making millions of new red blood cells every second and breaking down the exact same number every
That's right.
second,
That's right.
it, it was obvious to me that this was the obvious of randomity.
Hmm.
This was the ultimate physical plane expression of divine design and divine intelligence. And
Beautiful.
that idea really allowed me to be very comfortable with the realization of unity
Hmm.
and in general, but specifically, uh, given my background, it sort of
Right.
sealed the deal for me that
Hmm.
if I was ever going to be in a professional capacity and promoting myself as someone who people could pay their good money to, who would help them to move in the direction of the restoration of wholeness,
Yeah.
that I had to either have mastery, some mastery in all these domains, or at least I had to know what I didn't know and have a really good referral
Yes.
network to people who could handle things that I couldn't handle. And
Yes.
it blows my mind still in terms of the hubris and the arrogance
Right.
of so many health professionals. Uh, you know, if if all you have is a hammer, everything can look like
It
a
looks like a
nail.
nail. Yeah.
And
Indeed.
it's such a disservice to people to have them spend all this money and time on things that aren't going to work or that
Hmm.
or they can't deliver on the promise because it's a partial intervention. And
Yes.
so from the very beginning, I was committed to being who I needed to be able to provide that kind of way of being with people and that kind of breadth and depth.
Yes.
And, I've been on that ongoing mission ever since,
Hmm.
combined with a commitment to excellence um, and here I am. And now that I'm in my late 60s,
Hmm.
I've been in the healing and spiritual guiding arts now for 50 years.
Hmm.
I feel like I've earned the right to say some things.
Oh,
And
indeed.
combined with, hundreds of students and thousands of patients over the years.
Yeah.
And um, And just even in the time I've been in practice as a doctor for 38 years, um, so much has changed,
Yeah.
and we are really uh, it's really showtime now.
And for
I
sure.
mean, I mean, I
100%.
I mean this play of light and dark
Yes.
here in this 3D simulation here has
Right.
really come to the main event. And
Yes.
uh,
Indeed.
from a spiritual standpoint, it's very clear to me from a mission-driven standpoint. I can look back very, very clearly now on
Right.
my 69 years
Yep.
of the gifts, the talents, the challenges, the experiences, the circumstances, the miracles. I can
Right.
look back on it all and be quite certain that it was all preparation for this main event that
Hmm.
we're in right now. And
Yes.
so I'm in that context, I feel I'm in a unique position
Yes.
to share and to speak and to pay forward
Yes.
uh, things that might not likely come forward maybe through other people.
Well, clearly, and there's so much there, David. Just your acknowledgement that there is a divine design, and that there is an order, and that there's a divine intelligence that underlies things, and that's really a profound, kind of the humility to acknowledge that. For me, anyway, that brings a lot of peace. That this
Well, it
isn't
puts
sort of.
things in proper perspective. Like,
It does.
for
It does.
example, many healers, as you know, well-intentioned for various reasons, uh, within about 5 to 7 years, they burn themselves out. And
Indeed.
there's many reasons that can
Happened to
happen.
me.
We can
Yeah.
go into that on this show or another show, but uh, one of the reasons that they do burn themselves out is they lack the perspective and the humility to realize that they can't heal anybody.
Yes. Yes.
And if you are really believing that you can heal someone else, you've got yourself into a false God trap that
Yep.
eventually is going to disconnect you from your attunement with that
Right.
source.
Right.
And you're going to have some kind of a breakdown at some level. And
Hmm.
I think the fact that I have lasted 50 years
Yes.
shows that along the way, somehow I've learned how to have a right relationship, both spiritually and philosophically, and also energetically,
Hmm.
with what you're pointing at is um, I'm providing a function. It's not who I am. I'm providing a function, and it has to do with coherence. It has to do with alignment. It has to do with resonance, and then it has to do with the clinical experience of being able to translate that coherence into right relationship with that particular person at that
Yes.
particular time, given the totality of who that person, how that person's showing up in the moment. And that highlights something that I think is one of the gems or keys, and that is that uh, it's such an individual journey.
Hmm.
The food that's right for you right now might not be right for someone else. And the food that's right for you today may
Right.
not be the right food for you tomorrow.
That's right.
And so, um, one of the limitations of healthcare as it's practiced now is that most of the data that comes in that clinicians make decisions on are a snapshot in time,
Yes.
and to be able to have a healing art that allows you to get dynamic real-time feedback from the energy field right now,
Hmm.
and to have that information also as part of your layer of data, I think gives you a power that is difficult to access if you're making all your assessments based on a set of data that came in
Yes.
at one moment in time.
That's right. So David, how do you do that? That kind of real time, in the moment, current events, energetic assessment,
Okay. Yeah.
being current with a patient. How does that work for you?
Well, it starts out by my commitment to being present, because if there's nobody home, you can't pick up the phone. And so part of it is a commitment to being present, and that commitment extends to being aware, being present to when I'm not present, because anybody can be present when they're present. But if you're not present and you don't know you're not present, you can be not present for a long time.
Right.
And so part of, I would say, any advanced spiritual student, any advanced light worker is someone who has that commitment to being present, but also has the capacity and commitment to be aware when they're not here, to
Hmm.
to recognize it and to have the ability and the skill set to become present as quickly as possible.
Right.
So I
Well, that
and so
that
that commitment shows up in a lot of ways. Like
yes.
I make sure, like if I know I'm going to have a really busy day at the clinic, I make sure that the day before I'm not overextending myself. So
Yes.
it even extends to my weekly planning.
Right.
And then, and then there's a lot of things that go on at other levels too, in terms of attuning with my patients. I'm sure
Hmm.
there's a lot that happens the night before on the inner planes. There's a lot that goes on, but more practically speaking, when someone comes in, would this be someone who is a regular patient or someone I'm seeing for the first time?
Hmm. Right. Was that a question or?
That, yeah, because that what I would describe to you would be different.
Yes. Yes. Well, what I'm hearing is the part of your perspective includes a beautiful humility to know that A, healing comes from divine intelligence, and two, your acknowledgement of when you're in congruent alignment with your inner wisdom and when you're not. And that's, pretty significant that as an approach to working with folks. But yeah, let's just say it's a new patient.
If you have a new patient, all right,
Yeah.
they'll walk through the door and I will actually stand up and go over to them
Hmm.
and I will personally greet them,
Yes.
and I'll usually shake their hand and look them in the eye. And I'm starting to make a connection. I'm starting to
Yeah.
get a sense of them. And
Yes.
then I will ask them a couple of questions just to make sure they're here okay. And then I'll ask if they're ready to get started or if they need just a few minutes to
Hmm.
quiet down. And so that subconsciously is communicating a lot right there.
Sure is.
And then when they're ready, I'll invite them into the healing room where I do my work. And if it's the first visit, I'll pull up a chair for them. I'll have them sit down, and then I'll take my chair and I will turn it so that I'm directly facing them. And there's
Hmm.
no
Yes.
table between us, but there's
Yes.
a respectful distance, like maybe 4 or 5 feet,
Sure.
not 2 feet, not 8 feet,
Right.
something right there. And then I'll start. So by that time, I'm already starting to energetically get a sense of them,
Yeah.
and um, and then I start out by usually asking a very open-ended question,
Yes.
because I want to listen a lot more than I
Me
want to
too.
talk at the beginning.
That's right.
And so I say, "What brings you in today? How might I be of some help?"
Oh, quoting, that's exactly what almost verbatim
So
how we
so
start
by
with everything.
doing that, I not only get to hear their voice, I not
Right.
only get how they speak,
Right.
I not only get to watch their body posture and facial expressions and feel their
Yeah.
energy. I so I'm starting to pick up how they think, because you have to
Right.
think to speak.
Yes.
And by 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 seeing where they choose to put their attention and how they choose to express themselves, that
Hmm.
gives me a great idea of what their inner world is like, where
Yes.
they are. And so I'm getting that sense, but I'm also getting data of
Right.
what they're telling me about their particular interests and concerns. And then I'll ask uh, I'll ask deeper clarifying questions.
Yes.
And, I'll say, is there anything else? And there'll be some point in that interaction, usually happens within about 15 minutes,
Right.
sometimes maybe 20, but usually in that maybe 12 to 15-minute range, where
Right.
something in me will click.
Hmm.
Like I've got a sense of this person.
Yes.
And at that point, I will gracefully segue from doing that
Yes.
to inviting them to come over to this table and sit down on the
Hmm.
table so I can um, take a better look.
Right.
And so then they'll come over to a massage-like table and I have them sit down.
Right.
I'll ask them if they would uncross their arms and legs.
Right.
And at that point, the first thing that I do, and if I have a feeling that they're going to think that it's weird, I'm going to explain to them what I'm doing and why. But if it's a person that is already tuned into energetics, I'll just get started. And
Yes.
the first thing I'll do is I'll use the palm of my left hand
Right.
to scan the size and the balance of their energy field.
Oh, okay.
So a healthy energy field should be at least 7 feet in each direction and be
Oh,
symmetrical.
okay.
So, for example, I can get a lot of information, like if the person's energy field is non-existent or tiny,
Right.
that tells me that nothing's going to work until we get that field bigger.
Oh, okay.
Okay?
Okay.
If if the energy field is completely collapsed on the right side, that gives me a clue that, hey, I want to take a closer look probably at this person's liver.
Hmm.
Okay.
Okay. Okay.
That kind of thing. And so over the years, I've discovered common correlations between
Hmm.
what I'm finding in that initial pass,
Right.
and then I can verify it with muscle response testing.
Okay.
And then what I do is it depends what their chief complaint is. If their chief complaint is structural,
Right.
I'll usually start out with a hands-on structural assessment.
Hmm.
Okay. If their primary concern is metabolic or psychological or spiritual,
Right.
um, then what I'll do is I'll continue with a very sophisticated um, technique called morphogenic field technique, where
Okay.
I have a couple of hundred different vials
Hmm.
that I'm exposing the body to in a particular sequence,
Right.
and I'm seeing where the reactions are.
Hmm.
And I can do that by muscle testing. I can do it by feel,
Hmm.
by energetic feeling. And
And even remotely.
well, I'm there.
No, but I mean, I know you work with some folks remotely.
Yeah, yeah, yeah. Remotely, the first time I like to see them in person
Sure.
if we're going to do that kind of work.
Right.
But once I get it, once I know their energy, I can do it. I can do it long distance.
Okay.
Yeah. So it's an art. Like radionics is an art. It's an art.
Yes.
It's an art to be able to do that. But you not only have to be very empathic, but you have to be able to ask very clear questions and you have to have
That's
a
right.
broad knowledge of the energetics of different herbs and substances. So there are very few people that are really good at it. But yeah,
Hmm.
you can do it. It's doable. Once you know the frequencies of the different substances and
Right.
you know that person's field, it's possible.
Hmm.
But anyway, so between my structural analysis, my morphogenic field technique work, talking to them, and then I also have ways of using muscle testing
Okay.
to be able to determine what words or phrases cause stress at the subconscious level.
Oh, okay.
And that's really valuable.
Hmm.
Plus, I can recheck later
Okay.
to see if the intervention was effective at the subconscious level.
Hmm.
So that's very powerful, very powerful, very. I have saved some people years and years on the couch. on the
Hmm.
therapeutic couch that way
Wow.
because it's undeniable.
Right.
It's like night and day. The
Hmm.
difference with if you're an experienced muscle tester and you
Right.
can ask clear, unambiguous questions,
Right. Yes,
then you
that's
can let your
important.
mind go blank to get the answer,
Hmm.
and you know how to do this,
Right.
you can uncover subconscious limiting beliefs that would be very difficult for that person to uncover on their own. Very,
Huh.
very, very difficult.
Okay.
And because I'm so empathic, I have a good sense for what phrases or words to test.
Right.
Okay, so between that and between all the skills I have to help people with structure and movement, with all the skills I have to help people balance themselves biochemically, and with all the skills I have to help them in the metaphysical world,
Hmm.
that's how I work. Um,
Hmm.
and so basically, I'm looking for people that are open and looking for that someone where they don't have to go to 12 different people.
Right. Right.
You know, part of
Right.
the problem is there's a lack of functional integration among practitioners usually.
Yep. Very
And
common.
um, and of course, there's some people where I have to tell them that either because they're not willing to do certain things or because of certain medications they're committed to taking that
Right.
are um, scrambling their energy field so much.
Yeah.
Occasionally, you have to tell somebody that you don't think you're the right person for them right
Hmm.
now. And that's part of the art of being a really good healer is realizing what your what your sweet spot is, what your domain
Yep.
is, what you enjoy working with, what you're successful with,
Right.
and to know enough to know when it's not a good fit because it's good for you and it's good for the other person to get them out of your office as quickly as possible with a really good referral. Because
Yes.
sometimes, even though you weren't able to quote unquote help them,
Right.
because you cared and you were honest, a lot of times you might even still get a referral from that person
Yes.
later on, or maybe they'll come back to you later. You know, so it's just, it's good people practice and it's good healer practice and it's good business practice to not keep people in your office that you don't believe in your heart of
For
hearts
sure.
that they're in the right place. And that takes experience,
Yep.
that takes commitment, that
Yeah.
takes humility, that
Right.
takes some courage. But in the long run, it works better for everybody that way. Because with the level of energetic intimacy that I have as an empath, if I hadn't learned how to set proper energetic and behavioral and linguistic boundaries, I would have burnt out a long time ago.
Hmm. Yeah, I wanted to come back to that, but you shared so much there, David. What are some of the medications you found that can really scramble the energy field to a point where you may not be able to work creatively with a person?
I haven't been able to work well with people that are committed to artificial sweeteners.
Oh.
I haven't been able to work well with people that are committed to regular use of MSG.
Hmm.
Uh, I haven't been able to get really good results with people that consistently use high fructose corn syrup.
Sure.
I
Sure.
haven't been able to get good results with people that are unwilling to stop using, except for rare occasions, partially hydrogenated oils.
Hmm.
Um, there medications that suppress the natural functions of the body. You really give the body mixed messages. For example, let's say someone is on high doses of prednisone
Oh, sure.
and you're
Sure.
trying to deal with with an autoimmune situation or you're trying to
Right.
support their immune system, you're going to drive them crazy
Okay.
because they're getting mixed messages from the drug and you're getting mixed messages from what you're trying to do.
Right.
You know, or if you try to detox somebody that keeps eating crap, uh,
Hmm.
they're going to just crash. And so you
Mm-hmm.
learn these things over time if you pay attention. And then,
Yes.
of course, there are certain medications that you still work with the person, but you know it's going to be slower.
Hmm.
You know, like like it's very difficult to work with people who've been on statins for a long time,
Yep,
right?
I've noticed that.
Right, because statins affect myelination of
Right.
nerves, which
That's right.
affect how fast nerve signals can go, which
Mm,
limits what the nervous system can do, which limits the whole communication system
mm,
within the body. And you know you're going to be, if they're on statins for a long time, you know if they haven't paid attention, you know they're going to have to be willing to do a lot of other things. They're going to
right.
have to be willing to take a lot of vitamin D,
Right.
right? You know, if one thing that men are not told, which is I think a criminal, is that it will reduce their testosterone level.
Oh, for sure.
Yeah, and so you just have to let the person know that, I am not authorized to take you off your medications.
Right.
Many people have found alternatives to managing the things they're taking statins for. And if
Right.
you're interested in that, I can give you more information. But you just know it's going to go slower. And if
Please carry
people,
on, David. I'll be right back.
pardon me,
Yeah, please carry on. I've just got to let the dog out.
um, and so you got to take all these things into consideration, and you've got to go at a pace that you feel comfortable being the guide for that person. You don't want to set that person up to crash and burn, but on the other hand, you don't want to tell them there's no hope either. And so, um, unless somebody's facing something life-threatening, I think part of it is having a sensitivity to behavioral change and uh, not giving people eight things to do at once.
Right.
Maybe
Yes.
giving somebody one or two or at the most three things to do between now and the next visit. Uh,
Yes.
and another thing I want to say is that one of the things that I really pay attention to, and I want to talk about why it's important,
Mm-hmm.
is I really pay attention to people's breathing patterns.
Hmm.
Because what I've discovered is that people only heal when they're spending most of their time in a parasympathetic mode.
Yeah. Well, that's the healing
Right.
mode of the
And
nervous
so
system.
what I notice is the way most people breathe does not allow them to go into parasympathetic mode
Hmm.
because their body is anxious because they're not getting enough oxygen and they're
Right.
they're not getting rid of enough CO2 and they are efforting. Like for example, if you're not using your diaphragm as your main breathing muscle, then you're using accessory muscles like your muscles between your ribs and your
Hmm.
trapezius muscles and your scalenes to try to get enough air. But the problem is they're not meant for that. And it's very inefficient. Like, for example, when you take in air
Right.
in a breath,
Yes.
it takes about 350 milliliters of air in that breath before it even gets to the lung.
Hmm.
So if you're breathing fast and
Hmm.
shallow and you're spending a lot of energy working against your own diaphragm by trying to pull your tummy in and raise your shoulders when you breathe,
Right. Right.
when I imitate the way they breathe,
Right.
I start to breathe that way. Every time within 90 seconds, I start to feel anxious.
Oh, wow.
And
Hmm.
so one of the things that I do is I track that and I tell somebody, would you like to heal as fast as you can? And if
Hmm.
they say yes, then I give them the spiel about parasympathetic, blah, blah,
Yeah.
blah.
Yes.
And then I teach them how to breathe.
Hmm.
Actually have them lie on the table on their back with their knees bent. I have them put their hands on the lower part of their belly. And I say, what I want you to do is I want you to see if you can take a medium depth breath through your nose for about 4 seconds.
Hmm.
See if you can breathe in such a way that without forcing anything, your hands go toward the ceiling.
Yes. Yes.
And then I say, hold it for a second, and then open the back of your throat and just let the air come out by itself.
Hmm.
And that is a very powerful instruction
It is.
because you have to trust a lot to not try to control the exhale.
Yes, indeed. You're just letting go, not efforting,
So it's a
pushing
very
the air out.
sneakily powerful thing to have people do. And
It
then
is.
if they still can't do it, I would say 80% of the people can do it when you tell them what to do.
Yep.
But for the 20% that can't, I say, would you like me to demonstrate it? And then I'll
Mm.
lie on the table, I'll
Yep.
demonstrate it. And then I say, if you feel comfortable, I want you to take one of your hands and put it on my lower belly.
Yes.
And I want you to take your other hand and put it on my upper chest.
Right.
And I want you to just feel whatever you feel when I'm breathing this way.
Yes.
And then they get it.
That's great. I've done that thousands of times
Okay.
with people.
Yeah.
Teaching them
And,
that belly and
a little
chest.
clinical tidbit for your
Yes.
health professionals
Yes.
is that there are many factors that can cause it, but this inverted way of breathing is one of the common causes of hiatal hernia
Oh,
because the
okay.
diaphragm goes into spasm.
Interesting.
And so if you have techniques for breaking up the cycle of the diaphragm spasm,
Right?
you can handle a lot of hiatal hernias that way.
Interesting. Okay.
Anyway,
Wow.
so basically one of my early mentors was MT Morter Jr.
Who's that?
He was the developer of the best technique.
Hmm.
Are you familiar with that?
I've heard of it.
Okay. It was a non-force technique. And one of the things he said that struck me and has been kind of a guiding light for me, he said, there's two things every real healer has to be able to do.
Right?
You really want to help people on a deep level.
Hmm.
He said, number one, you have to help them get out of defense mode,
Hmm.
out of sympathetic mode.
Yes.
You can't be in both at the same time.
Hmm.
And
Right.
so I'm very sensitive to that,
Okay.
very sensitive to that, because otherwise you're spitting in the wind. And there's so many, I mean, it blows my mind when I think about the number of healers that pay absolutely no attention to whether the person they're trying to help is in sympathetic or parasympathetic mode.
Right.
So
Right.
that he said that's the first thing. He said if healing is hitting a home run, you can't get past first base without that.
Right. Well said.
Assuming you do that, and he's speaking metaphysically now, he's
Yes.
saying the next thing you need to do is what he called update memory.
Update memory. Okay.
And he's talking about engrams.
Okay.
Okay. So for those of you who don't know, an engram is a um, is correlated with in consciousness during trauma or unconsciousness or shock or loss
Right.
or extreme pain. The brain kind of goes into safe mode
Hmm.
and kind of goes into this very primitive reptilian logic system.
Hmm.
And um, there's a portion of your consciousness that gets stuck in
Okay.
that prior moment of trauma or unconsciousness.
Right.
That's what he means when he's talking about update memory.
Oh,
He's
okay. So
talking about
this,
you got to help somebody,
right.
whether it's consciously or with either, by consciously recollecting that, or there are other ways sometimes to bypass that. But somehow, like before, I talked about the methods I use to
Yes.
see if the phrases or the words trigger a stress mode for a patient
Right.
subconsciously. That's a way that I'm finding the engram.
Oh, okay.
Okay. So the the muscle test can't tell you what is true,
Right.
but the muscle test can tell you what the person believes is true.
Okay.
And it can also tell you where the engrams are.
Hmm.
So for example, if I have a strong muscle when the person has their eyes closed,
Right.
and I have the person say, uh, I love myself,
Okay.
and I recheck the muscle. That tells me whether subconsciously they believe it's true or not.
Oh, okay. Okay.
And that's very valuable information.
Hmm.
Or
Indeed.
you can use a word that is normally associated with positivity and see with and test it with the person's eyes closed.
Right.
Like you could use a word like love
Yes.
or uh, or power
Right.
or freedom or responsibility. And if you're testing that with their eyes closed and the muscle was strong and the muscle goes weak,
Right.
you know there are limited notions
Oh, okay.
associated with those powerful ideas that
Okay.
subconsciously are creating a so they consciously want this, but unconsciously they don't.
Interesting. Okay.
And for people that are willing to work at that level,
Yep.
it's a very exciting experience for the person
Hmm. Well, for sure.
because then
Well,
once you've opened that door and they're open to the possibility that maybe there's something there that needs to be aligned properly,
right.
that opens up a world of possibility that didn't exist before that moment.
Well, it does, and it also sheds some light on why some folks know what to do, how to eat well, regular activity, meditation, whatever it is, but don't actually do it. And it might be,
Yeah,
from what you're pointing to, at least part of that might be in some cases this unconscious resistance which may have to do with self-image or self-identity, that there's an internal block.
absolutely. In fact, I'm a big fan of a type of therapy called
Yep.
coherence therapy that was
Okay.
developed by Bruce Ecker and his wife. And uh, coherence therapy takes the point of view that in these situations, the the limited belief or the misperception that's associated with this,
Right.
that within the context of that person's psyche,
Right.
it's fulfilling, attempting to fulfill a legitimate function.
Right.
It's just not fulfilling it.
Hmm.
And so you don't want to take that away from somebody. Like maybe they smoke
Right.
to avoid a certain feeling, but maybe they're the kind of person that if you took away smoking, they would
Right.
take a gun and shoot 8 people.
Hmm. So they're
Okay.
not ready to
So
make that
so
change.
so so this is a really important point about the ecology of healing.
Hmm.
You know, you could look at people's dysfunction, dis-ease, misperceptions. You
Right.
could look at them as bad,
Hmm.
but the minute you look at them as bad, you've made a judgment and you've shut yourself off from your own connection to source.
Yes.
It's like saying, God, you blew it. It's,
Right.
it's like saying, I know better. That shouldn't be that way. That was a
Yeah.
mistake. And
Yeah.
so, and so one of the things that's really part of the art of deep healing is
Hmm.
to have this multidimensional perspective,
Hmm.
where on one hand, you're very sensitive and attuned to imbalances,
Right.
but you're not being that the imbalances are bad.
Right. Okay.
In
Okay. It
fact,
may serve a purpose.
yeah, in fact, without imbalances, I might be out of a job. I mean,
Hmm.
it's like that's tongue in cheek, but
Sure.
you get
Sure.
my point. It's
Yes.
like, are the imbalances happening to you or are the imbalances happening for you?
Ah, look at that. So
Okay,
there's
and
the gold in the
it's
wound.
the
And
same thing about why are your hormones moaning? Are
hmm,
they moaning because they're doing something to you? or are they doing something to for you? Are they trying to get your attention about something that's not incoherent?
Mm.
And so, it's, if you want to be a good healer, you've got to be in the flow. You got to be in the zone. And the minute
Yes.
you have decided that something is right or wrong, good or bad, you're now in judgment mode, and now you're out of your own flow. And now it's harder
Mm.
for the other person to cohere to your coherence because now you're incoherent.
Mm.
Uh,
Mm.
and so, so one of the things that I think subconsciously communicates powerfully in a healing way to the patient
Mm.
is that when I find something in them that's out of balance,
Right?
I get excited.
Yes.
And
Okay.
they're aware that I'm really confident and excited about this because I'm confident that one way or another, now we're aware of it, we can begin to handle it. And
Yes.
because I'm not in judgment about it, it kind of subconsciously gives them permission to not be in judgment about it. And a lot of the time, what's keeping them from being willing to face things is their judgment about the thing that they're afraid to face.
Yes.
And
Well,
so
that
there's so
that
many.
reframes this whole symptomatology as enemy,
Yeah,
right?
I mean, one of the things
There's
I
a
love about
symptom.
homeopathy is
Yes,
that
there's something
the
wrong,
classical homeopath is
and
using
there's
is
this
seeing the symptoms as the body's
downstream.
incomplete attempt to handle an imbalance.
Yes.
And like I tell people, have you noticed that dead people don't have symptoms? And that's a very powerful idea to interject with people. That symptoms, what we call moaning,
Mm.
these are expressions of life attempting to recover balance and coherence. And so it's very powerful when you ask people, have you noticed that dead people don't get sick? Have you noticed that dead people don't have symptoms?
Mm.
And it's shocking to them, but it's shocking to them in a good way.
Yes.
Yes,
Yes.
and this
Well,
whole idea of, well, I may be preaching to the choir here, but this whole ego-based, matrix-based way of looking at things through a fundamental lens of competition and scarcity and duality and polarity and right, wrong and good, bad and judgment.
yes.
You could make a strong case that that is the problem.
Mm.
You could make the case that if you shifted to a way of being and living that was based on uh, a deep faith in abundance, cooperation, synergy,
Yes.
infinite beingness, you could make a case that maybe 85% of our health problems would vanish.
Mm.
And so, other than, you know, other than some really deep genetic disorders that are rare, or 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 getting into a car accident, or if your environment was pristine and your
Yes.
inner consciousness was clear,
Right.
you can make a good case that a good 85% of reasons why people don't feel well or go to the doctor would automatically disappear. And so, it's almost like we're practicing within a series of Chinese boxes
Yes.
of imbalances. You know,
Right.
we have
And
we have structural imbalances, we have biochemical imbalances, we have misperception imbalances, we have ecological imbalances, we have ancestral imbalances. And
yes.
so that's why, if you have an appreciation through your own healing journey for all
Mm.
of that, and for what the courage it takes to go through that, and what a hero's journey that is,
Mm.
um, I think it serves you well when you're dealing with other people, because you've walked in those shoes and you have compassion for them, and because of the amount that you've overcome and what you've gone through, that uh, that the healing is really possible and that miracles do happen, and miracles are just things that happen with the physics that we don't understand yet.
Yes. Well, right, and I love that point, David. Just to underline something you shared that was so wonderful. That the conventional part, and we see this even in so-called holistic therapies, is seeing the symptom, the illness, as enemy
Yes.
that needs to be defeated, and understanding at another level that we can look at symptoms, illnesses, conditions as teacher, not as enemy, as something that might possibly maybe be an expression of the body's wisdom, that is pointing, that maybe was a protective thing that was there for a healthy adaptation. It could be there as asking us to pay attention to something in our lives that we haven't paid attention to, which could be as simple as like a diet change, or a deeper trauma that we just weren't aware of that was from the past. But this reframes
Mhm.
the therapeutic process as not defeating enemy symptoms,
And yet
make
at the
it go
same time,
away.
it's important not to become dogmatic about that,
For sure, because that's,
because
honor what brings people in.
not only that, but we're also dealing in a world where we have to deal with the level of consciousness that we're at. So, for
That's right.
example,
That's right.
I'll give you a couple of examples. So, I believe that at some level, at some point in my soul's journey, I will reach a level of consciousness where I can consciously generate my perfect hormonal balance. Okay. I believe that at some point I can get to a level of consciousness where I can always manage my discomfort without anything that's suppressive. But I'm not dogmatic about it. Like for example, if someone has a terrible toothache,
All right. Let's help out that toothache.
I'm
Yeah.
have no problems, you know, saying, hey, if it were me, I'd probably take ibuprofen for a few days. You know what I'm saying? So, and or for example, take the hormone situation. Okay, our hormones evolved over thousands and thousands and tens of thousands of years of living, but we're facing physical and metaphysical realities that are recent, right?
Right.
Right? Our genes haven't adapted yet. Our consciousness
Right.
hasn't completely adapted yet. Like, for example, until a few hundred years ago, most women didn't live that long beyond giving birth and raising their kids, and then they would
Yeah.
die.
Yeah.
Sanitation issues, infections, other
Yep.
things.
For sure.
Okay. But now women live commonly well into their 80s.
Yep.
But but a woman will have virtually no estradiol and no progesterone after about 50.
Hmm.
Okay. And we're finding out that natural progesterone and estradiol do some very, 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 very important things that now science has measured. There are
Yep.
journal articles that are very, you know, uh, well accepted now that most physicians don't even read. But
Yes.
it's well known now. This isn't airy fairy stuff, right?
Hmm.
We know now that uh, that there are so many benefits to many, many women, not only for emergencies like postpartum depression
Hmm.
for natural progesterone, but just in general, bone health, cardiovascular health, cognitive health,
Hmm.
uh, with optimal amounts of estradiol, natural progesterone, testosterone, DHEA, thyroid, etc., and um, vitamin D. And so I'm a visionary, but I'm a practical visionary.
Mm,
It's like I do believe at some level we won't need these things, but I'd much rather give us this training wheel for where we're at right now,
right.
because it seems to, when it's done judiciously in a holistic context, uh, the risk reward is the reward to risk is just off the charts.
Mm.
So I'm
Well,
giving you examples about how
yes.
basically what I'm talking about is I'm talking about the principle of gradient. Remember, I talked about how healing is so individual,
Yes.
and the thing you might say to someone, and you might say something completely different. In fact, you might even say something almost opposite to
Mm,
another person who's at a different level.
right.
There's a great story that brings that point home that I heard from Ram Dass once.
Mm,
And this is a great story.
yeah, yeah.
I think you'll love this story.
Sure.
And it illustrates the point about how, as a teacher or a guide, you need to be sensitive to the moment and who the person is.
Mm,
And so he tells a story about one of his disciples was in the hospital for something. And he went to visit one of his disciples at the hospital, one of his students. And when he got to the hospital, his student was lying there in a gurney. And then right
mm,
next to him was an old lady who was lying in a gurney.
mm,
And they were both complaining about the pain they were in.
mm,
And so the old lady's complaining about the pain, and Ram Dass says, "Oh, I'm so sorry. Do you want me to fluff up your pillow?" Da, 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 da.
mm.
And then he turns to the student who's complaining about his pain, and he goes, "Cut it out. Get off it."
That's great.
So I love that story.
Yes.
I love that story because that shows how present as a healer, teacher, guide you have to be
Yes.
in order to get out of your head,
Yep.
be in the flow, and know, and just know. If you have to think about it, that's not it,
That's right.
And so, in my experience, there's very few healers that get to that level of mastery where they don't have to think about it.
Mm.
But if you can get there, that is possible. And I think that story says volumes right there.
It sure does. It sure does. And and it really speaks to this idea of being so present with a patient without conceptions of, well, I did this way last week or last month, or I've always done it this way. Um, and
Yeah, I use the
so I'm going to,
example of I use the example of golf.
yes,
You know, a professional golfer is going to spend hundreds and thousands of hours practicing on the driving range, practicing putting, thinking about things, critiquing things,
yes,
trying to tweak his swing or her swing. But if they're in a tournament and they're in their head like that,
right,
they're going to go broke.
for sure.
They're going to go broke.
Yep,
You have to be so present
indeed.
when you're actually playing competitive golf that you
That's right.
can't be playing how's my swing. You have to be playing that shot in that moment on
Yes,
that terrain with how you're feeling that day, with how the wind is blowing, what the temperature is, what
yes,
the humidity is, the slope of the green, how you have to be right there. You can't be in tweaking your putting technique. You can't be in that. And so to get to that level of mastery requires a tremendous amount of dedication and practice, but you've got
right,
to know how to shift gears from critique mode to
right.
just being present mode, because there's not being present mode isn't better or worse than critiquing mode, and
Yep,
critiquing mode isn't better or worse than just in being mode, but being in the appropriate mode for the appropriate occasion,
yes,
that's part of increasing the odds of being in the flow,
right.
right?
So,
So that's really
David, I'm
important.
just, yes, yes, indeed. I'm just gonna just for change it up a little bit. I'm gonna play a very funny clip from I think this is probably the 1970s. This is the Bob Newhart show, a very famous clip that It just reminded me of this. So let's just listen.
He was a psychologist. He was playing a
He was
psychologist,
a
right?
psychologist in the
Yeah.
show.
Tell me about the problem that you wish to address.
Oh, okay. Well, I have this fear of being buried alive in a box. I start thinking about being buried alive and I begin to panic.
Has anyone ever tried to bury you alive in a box?
No, but truly thinking about it does make my life horrible. I mean, I can't go through tunnels or be in an elevator or in a house, anything boxy.
So what you're saying is you're claustrophobic.
Yes, that's it.
All right. Well, let's go, Catherine. I'm going to say two words to you right now. I want you to listen to them very, very carefully. Then I want you to take them out of the office with you and incorporate them into your life.
Well, shall I write them down?
Well, if it makes you comfortable, it's just two words. We find most people can remember them.
Okay.
You ready?
Yes.
Okay, here they are.
Stop it!
I'm sorry?
Stop it!
Stop it?
Yes, S-T-O-P, new word, I-T.
So, what are you saying?
You know, it's funny. I say two simple words, and I cannot tell you the amount of people who say exactly the same thing you're saying. I mean, this is not Yiddish, Catherine. This is English.
Stop it!
So, I should just stop it.
There you go. I mean, you don't want to go through life being scared of being buried alive in a box, do you? I mean, that sounds frightening.
It is.
Then stop it!
I can't. I mean, it's been with me since childhood.
You know, that's so funny because it reminds me of when people discover experientially how they've been their own quote unquote worst enemy sometimes.
Yes.
I say something to lighten it up. I say, you know, did you hear about the person who comes to the doctor and says, "Doctor, my head's hurting"?
Yes.
You know, so people don't realize what it is. You know, it's like I think about that line where Jesus says, you know, forgive them, Father, for they know not what they do.
Yes. Yes. At the end.
You know,
Yeah.
that's kind of a guiding light in my life is
Mhm.
it has helped me so much because I think about people who do things that on many levels are completely atrocious.
Mm.
Like
Sure.
I think about people um, that sell children into sex traffic.
Yes.
You
Yep.
know, I think about the most evil people you could think of.
Right.
And it doesn't work for me to be in judgment and close down my heart, but
Right.
yet I'm not an idiot. And
Well,
so,
yeah, we have to
and so,
name
and so
evil.
a tool that I've used to get to the point where I can forgive those people
Hmm.
is I think to myself, if the world occurred for me the way it occurs for them, if I occurred for myself
Right.
the way they probably occur for themselves,
Right.
if other people occurred for me the way other people occur for that person,
Right.
I might behave the way they behave.
Hmm. Mm-hmm.
And that has helped me so much to not throw the baby out with the bathwater. That has
Yes.
helped me so much
Yes.
to maintain discernment and a commitment to virtue, true
Hmm.
virtue, and not get caught up in this moral relativism
Right.
BS,
Right.
but at the same time to stay in the flow and to not close down my own heart.
That's right.
And that is a really valuable thing to be able to be and to do.
Well, it is because what a gift that is to be a presence for someone that has compassion, but also not to kind of support them in continuing the patterns that got them into this spot in the first place that brought them to you.
You know, one of the things that I do is I also write. I
Hmm.
also write and speak. And one
Yes.
of the things that I've been a enormous outspoken critic of, because I think it plays into so much of what causes disease in our world,
Yes.
is moral relativism.
Oh, it's
Is
it's toxic. It's a
the
cancer.
idea that all viewpoints are equally valid.
Yes. This is my
All
truth. Yeah.
like like yes, you have a right to your beliefs.
Yep.
Everybody has the right to their own beliefs.
Right.
Uh, but to say that there's no objective standard
Oh, it's poison.
of true virtue,
It's poison.
that's like that, because what happens is all debate then devolves into, well, that's your view and that's my
Right.
view. So, for example, that I can say that from my point of view,
Right.
uh, that pedophiles that pedophiles should not be allowed to be around anyone that they may violate,
Right.
you know, and someone else may say, well, that's just your opinion.
Yep.
You know, someone might just say, well, or they can say, well, this 8-year-old says that I love him,
Yep.
and he says that he loves her,
Yep.
you know, and so
Right.
it's like it's a way to it's a way to infect society
Oh,
to
absolutely.
the point where it must break down.
Yeah, there's no objective morality.
It must break down.
Yeah.
It's so incompatible with the laws of God and creation that
Absolutely.
it can't continue to exist. And so
No.
uh, this has an enormous impact, especially on people that were born into that
Right.
without a alternative frame of
Well,
reference.
yeah, there's right and wrong.
Well, the way I like to think about it is because it takes me out of judgment.
Yes.
I don't like to think of it that way.
Yep.
I like to think of it is that there are laws of God in creation, and that
Right.
if you exist in harmony with those laws, whether
Right.
you're an individual or a group or a culture, you will thrive.
Hmm.
And in this 3D human experiment,
Yeah.
human beings have free will within a very broad domain. People
Yeah.
can believe whatever they want.
For
People can
sure.
think whatever they want. And so because of that, you're going to have high contrast realities. You're going to have things that work really well in reality, and you're going to have things that don't work well at all in reality, and you're going to get stuff in between.
Right.
And so I like to think of it that way, that that just doesn't work.
Yep. It's not supportive of life and human thriving. Like,
There's just certain things that don't mesh well in reality that
yes.
are way beyond your opinion or my opinion,
Yes.
you know? And you know, there are just certain things that just don't work that well. Like I'm sure you've experienced this. You know, you're probably pretty introverted by nature, like I am. So you probably are like me, where we may accept maybe only 1 out of 50 invitations to be in a group.
Hmm.
Okay, we're very selective
Yep.
because we're very sensitive to how one bad apple in that group can devolve the group, and
Yes.
how the squeaky wheel gets the grease.
Right.
And uh, there, this brings up the issue of if you're committed to workability at any dynamic, the importance of discernment and proper boundary setting. Because if you believe that to love people, you have to have no borders,
Hmm.
either as a country or as a person,
Right. Right.
you're going to die.
For sure.
And you can see that in a cell. Once the cell loses its discernment at the cell membrane
Right.
about what it's going to let in
Oh, right.
and
I
what
see
it's
what you're
going
saying.
to make
Yes.
and what it's going to let out, that
That's
cell's
right.
going to die.
Yep.
And it's going to die very quickly.
Right.
And then more and more cells will die. And then systems will break down. And then the person will die.
That's right.
And so if you think to love means you have to be all things to all people
Yep.
and say yes all the time, you're going to die.
Yep.
You're just going to die a little slower death than that cell because you're made up of trillions of them, but you're just going to die a slow death. Your life will become less workable, less workable, less workable. And
Yes.
so having inappropriate boundaries goes both ways. You can
Yeah.
be so closed
Right.
that you could be starving in the midst of plenty.
Yeah. You're numb to life and
And
not
so
able to let people in.
And so one of the things when I work with other empaths who have trouble with boundaries is one of the things that I do is I say, look, just because you have this ability to merge doesn't mean it's always to your advantage to merge.
Yes. That's right.
And then I give people a guided visualization where I imagine that that under their right hand is a dial that they can turn from 0 to 7. And when they turn it, when it's at 0, the weave of their aura is very tight, like a pinpoint weave. And if they turn it all the way to 7, it's like a fishnet.
Hmm.
And I have them play with, okay, see what a 0 feels like. Feels what a 1, a 2, a 3, a 4, a 5, a 6, go back 7, go back to 6, go back to 5, go back
Yes.
to 4. Because there's a meta message there that's tricky, sneaky. The meta message is you have control of that.
Hmm.
You have some agency in how tight or loose your field is. And I give the example. I say, look, if you're making love with your beloved, you probably want your fishnet field.
Hmm.
But if you're walking down a rough part of town at 3 in the morning in a dark alley,
Yep.
you might want a pinpoint weave.
For
And
sure.
again, this is another example of bringing to consciousness something that most people have never thought of. That in
Right.
the same way you can take responsibility for whether your arm is here or whether it's here,
Hmm.
you can get to a level of consciousness where you can take responsibility for adjusting the density of your field. And very often when you're in the flow, it'll just happen spontaneously.
Yes. Yes.
So um, I really appreciate, I feel like we're kind of jazz musicians riffing here.
Yeah, indeed. Well, a couple of questions for you,
Yeah,
David.
yeah.
We have a question from a patient of yours, Kathy. My question is, what are the benefits and differences between bioidentical hormone therapy and bioidentical hormone optimization?
I use the terms interchangeably. I'm
Okay.
I'm into optimization. In
Yep.
other words, this thanks for the question, Kathy, because it brings out an important distinction. And that is, and I'm sure Michael's talked about this quite a bit on other shows, but when you look at lab values, those lab values are statistical averages based on sick Americans at different ages.
Hmm.
Now, do you want to be normal that way? Or do you want to be optimal? In other words, to 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 um, to have your North Star be normal within lab reference ranges uh, can be very non-optimal. It
Hmm.
usually is very non-optimal. Again, partially because that lab work was just a moment in time, but also because of the way the statistics are drawn. And so if if you're going to be a postmenopausal woman, your statistical average is going to be that it's totally normal to have virtually no estradiol, and virtually no progesterone. But if you're concluding that because it's normal, it's optimal, now you're just lamb to the slaughter. You're just sheep to the slaughter. Whereas once you understand what I'm saying, then you can ask the question, well, is statistically normal optimal? And once you ask that question, that opens up a whole new world. And then
Yes.
there's a whole new world of study that can be done based on not trying to get people in the normal range, but getting real world and laboratory feedback in terms of well-being references, functional
Yes.
references, to see how people actually are functioning and how they feel, how effective they are, how peaceful they are, how much they're enjoying being a man, how much they're enjoying being a woman,
Yep.
how motivated they are, how alive they feel, what their sex drive's like. So many different things that uh, these are conversations that just don't have the space to show up until
Yes.
you begin to question whether normal is optimal. So in that sense, Kathy, that's a great question. And it reminds me to be a little more conscious in my use of language to make
Yes.
sure that I use optimization.
Yeah, that's great.
Yeah,
And what I
Kathy, I'll
like to,
send you a check for that one.
yeah, yeah, for sure, for sure. What I like to explain to patients is there's a place for exogenous hormone therapy, for sure, particularly in a very imbalanced, depleted patient. And the goal is to help encourage endogenous, or what the body makes on its own, to over time strengthen and rebuild that balance, so that over time there's less of a need for an exogenous input.
Absolutely. In fact, that was one of the reasons I wrote the book, because, you know, hormone now becomes the new shiny object of
Indeed.
the next magic bullet.
Yes.
And I wanted to make sure it didn't devolve into that.
Yeah.
And that, and that,
It's
and
about
that, and
David.
that hormone optimization is done in the kind of holistic context that we've been talking about during
Yeah.
this whole conversation. So for
Yeah.
example, one of the ways that that practically shows up for me in my practice is that I will hardly ever, ever, ever recommend testosterone for a man under 40,
Mm-hmm.
because there's so many things that a
Yep.
man under 40 will often respond to
Right.
prior to that.
For sure.
Whereas it's totally different if you're dealing with a 65-year-old man. It's
Right.
completely different. So
Right.
so there's a so your point is very well taken, and it's one of the reasons I wrote the book, because
Yeah. Tell us about the book, David. What will people find in this book?
they'll find powerful answers and questions to the title. Why are
Hmm.
your hormones moaning? And then once you know why they're moaning, then there's ways of being with that. And then there are things that you can be and do. And so, again, this goes back to first principles, is why is this happening? Is it happening to me because I'm like this? I'm over the hill and I'm breaking down, and this is my path to a slow death?
Hmm.
Or is there an opportunity here?
Yes.
Like one of the things I want to address is this idea that aging is the enemy.
Hmm.
I mean, we have whole industries now that are based on anti-aging.
Yeah. Oh, for sure. It's
Okay,
huge.
now aging has now become the new enemy.
Right.
Okay, I say that's nonsense.
Hmm.
I say that there's ways to age gracefully. I say that autumn is as beautiful as spring.
Hmm.
I say even winter has beauty that summer doesn't have.
Yes.
And so there's a season for
Stages and
everything.
stages. Yep.
And or just think about the stage of life I'm in right now, and think about the title of this interview.
Mm-hmm.
It's not called I'm Falling Apart.
Yes.
It's called Full Harvest
Yes.
and Paying It Forward. Okay? So there's a season for everything. And uh, all I can say is, and it's a deep idea, but if you can wrap your head around this, it'll help you. Watch the tendency to default into looking at everything in terms of avoiding the domination of the enemy.
Hmm.
So, ego-based consciousness is coexistent with a hypervigilance to attempting to identify and avoid the domination of the enemy.
Hmm.
Why do most people go to work? Not because they're inspired to go to work. They go to work to avoid going broke.
Hmm.
They're going to work to avoid the domination of being broke.
Hmm.
Okay? So this whole way of being and living that
Right.
it's kind of our default setting. It's kind of our primal survival default setting is be hyper vigilant and look out for danger and organize your life first and foremost to avoid the domination or potential domination of that danger or that potential danger.
Right.
And if you do that, you're going to get what we've got. That
Right.
way of being gives you the world we've got. And
Yep.
so it gives you the you that you've got. And so
Hmm.
that way of being got you this far, but it doesn't mean it's going to get you any farther. It doesn't
Right.
mean just because you are surviving doesn't mean that if you do more of that, you're going to be thriving. The
Hmm.
rules for thriving are completely different than the rules for surviving, but you have to
Hmm.
be responsible for surviving if you want to stay in the physical plane to keep thriving. And
Yes.
so what I'm saying is a very deep thought, but if you can get a hold of it and you can take an honest look at your life, how much of how you spend your time, how much of what you focus on, how much of what you prioritize, how much of where you put your energy into is basically an attempt to avoid the domination of what you're afraid would happen if you didn't do that or you
Hmm.
didn't say that. And you know, there's nothing bad about that, but it limits the possibilities. And what it's going to say on your tombstone is was committed to avoiding the domination of something.
Right.
And
Right.
and you get to be right because in your world, if you're constantly focused on the thing you want to avoid the domination of, you
Right.
have to keep that thing in your energy field to keep attempting to avoid it. So
Hmm.
you're going to be right. You're going to have evidence that proves that you were right. You were justified in organizing your life that way. And so
Yes.
you get the booby prize. You get to be right.
Hmm.
And so and so it's not that that way of being is wrong. It's just that it can't, if you do more of it, if you do it in a different way, if you try to do it better, it won't get you where you really want to go. Because where you
Hmm.
really want to go, that you don't consciously know you want to go because you haven't thought about it,
Right.
until you meet somebody weird like me, is that what you're really after is thriving. But you
Yeah.
got so into avoiding the domination of the enemy that you
Right.
forgot that that wasn't going to get you to thrive. And maybe you
Hmm.
even forgot that originally you were meant to thrive. And so
Hmm.
this is a very deep idea. And
Yes.
eventually, if you're really committed to self realization and high levels of wellness, this is a level of being that you're going to confront sooner or later.
Yes.
And so, one of my gifts is to be able to articulate and bring to your awareness something that may be something that you didn't know that you didn't know, that if
Right.
you knew it, could really help your journey to be a lot smoother and a
Hmm.
lot more joyous.
Excellent. Well, yeah, when you're in a mode of seeking optimal life or expressing optimal life, of thriving, not just surviving, then there's a different attitude of finding good, finding light, finding blessings, cultivating an attitude of appreciation.
And also,
And
you don't need to have so many potential dangers to avoid to stay
right,
motivated.
right. Hmm. Well, it gets back to something you said in the beginning of a sense of trust in life, that divine intelligence is benevolent, seeks your good, your thriving, um, and that there's a sense of relaxing into that.
And
We had a
yeah, I mean, that opens up a whole discussion about
It does, and we had
how
a question.
that opens up a whole discussion about how our society teaches mothers to
Yes.
be with their children at an early age
Mm.
to foster this sense of basic trust.
Yeah, and right, a sense of like you have a basic resilience rather than just avoid all challenges, you know. So we had a question for you, David, from this is from Sylvie, was asking about a link for the Korean study and also the Japanese oncologist and the Cleveland Clinic study.
I
So
I, I
just
don't
looking for some
I
references.
don't have those references at hand,
Okay.
but if you go to any good AI
Yep.
and you ask for references specifically on what it is you want to know and
Yes.
ask for the journal references, you'll be able to find them.
Yeah. Great.
Yeah.
Thank you. And then let's see what we had. I think we had one other question.
Yeah.
Oh, yes. This is from one of our regular listeners. This is from Richard. And he is asking, how do you handle genetic fault disease, DNA mistranslation to RNA as diagnosed, with people that are having detrimental disease from those genetic faults of DNA mistranslation to RNA?
I just take the point of view that there's so much we don't know about epigenetics and gene
Right.
expression.
Indeed. Indeed.
I just take the point of view that it's worth a try.
Yep.
If I'm doing something that I know can do no harm, I say it's worth a try. And I say anybody who is giving their power away to their DNA needs
Yes.
to really study epigenetics. And there's a
Mhm.
really important breakthrough book that's written for intelligent lay people called The Biology of Belief
Oh, for sure.
by
Lipton. Yep.
Bruce Lipton,
Yep.
where he really popularized epigenetics for lay people.
Hmm.
And he talks about the studies that he did that validated the reality of epigenetics, which basically says that the DNA is like a blueprint, but the possibilities and the expression of that DNA vary so much with your physical and metaphysical environment
Yes.
that to me, as long as I'm doing something that I know is safe and
Hmm.
it's not interfering with some other medication, my view is let's give it a shot.
Yes. Let's try.
Yeah.
Yep. Yep. That's excellent. Very good. Those are our questions. David, just want to just two other things. If you could just give us a little tour of what people will find here at davidkamnitzer.com. Uh,
That's that's a website about my my one-on-one work with people.
hmm.
A a lot of it can be done long distance. Some of it needs to be done at least initially in person, and it goes into the different levels of work, and it goes into my philosophy, and there's tons of
Hmm.
testimonials in there, and there's some FAQs. And then I have another website that's dedicated to the book where
Oh, yeah.
instead of davidkamnitzer.com, it's drdavidkamnitzer.com, and
Oh, okay.
that specifically goes into the book.
Great.
And basically, the people who tend to get the most value out of working with me are people who have tried a lot of other things before. They're taking responsibility for their health. They've they've really they're a certain way along the path, but either they're reaching a plateau or they'd like to go faster.
Yes.
And for people that, those are the people that I really work the best with. And then probably the people who get the most value with me, although it's not necessary on
Right.
top of that, would be people that are already on some kind of conscious spiritual growth journey as well.
Yes.
Uh,
Yes.
and usually, um, what you see is what you get with me. So
Hmm.
probably have a pretty good sense if you've made it this far. If,
Indeed.
if I'm a person that you think might be the right person
Sure.
to help you at this point in your journey. And usually we can tell pretty fast. And like I said, if we're not a good fit for each other, uh, we just part as friends. And so,
For sure.
like that.
Excellent. David, any final thoughts that you had for our listeners today for you to feel complete with our time?
Well, first of all, I don't take your attention for granted. This has gone on for a while. And, you know, I don't like speaking to a wall.
Indeed.
I'm moved by the consciousness of the people that are asking sincere questions and are
Yeah.
sincerely asking for help. I'm that kind of a person. I'm that kind of a
Yes.
teacher. And so there's no sincere question that's a bad question.
Hmm.
If something is moving in you, like even though I put out a lot of information,
Hmm.
this really isn't about information.
Right.
This is really about standing on the information and the conversation
Yes.
to a place that all that is pointing to,
Hmm.
that's beyond the words, that you discern with the heart,
Yes.
not so much with the mind, and you just allow the mind to be a tool of the heart. And so we talk a lot about presence today.
Hmm.
If something's been present for you that feels, on one hand, ancient and familiar, but on the other hand, maybe a little disconnected from,
Hmm.
and you think that interacting with me can help to stabilize that and expand that, that's
Yeah.
probably the best clue for whether to reach out to me or not. And
Yes.
please give me and or Michael feedback on this to see how
Yes.
it's moved you, not just entertained you, but really moved you, that's made a difference for you.
Yes.
Uh, and then if you want to communicate with me directly, there's contact forms
Yes.
on on my website
Excellent.
you can use.
Wonderful. Well,
How about you,
I,
Michael? Anything you'd like to say in closing?
oh, I just appreciate the conversation. We've covered so many meaningful areas that have to do with this theme of human thriving and us and assisting each other in fulfilling our unique destiny and potential in life. That we each came to contribute in a particular way, and we came to help each other in doing that in whatever way seems natural. So I just appreciate your, decades of helping people in that way to help people from the, as one of my teachers said, holistic care is being able to help someone from the most superficial levels of their symptoms to the depths of their being. And I just appreciate your cultivating that in yourself by going to those places in yourself. I've often said we can help someone, at least practitioners, but it's just people to people as well, and just friend to friend. But we can help people to the depth we've gone in ourselves. And I just very clear to me that from a very early age, you have sought to go to depth in yourself and asking deeper questions, asking meaningful questions that have helped you go to depth in your own journey of self-exploration and awareness that just make it obvious that you are able to help people go to that depth within themselves with your being in your presence in whatever way. So I appreciate that, and I know that that spirit of inquiry it permeates your book. I really encourage people to get your book and to learn from that as well, and to sense, is there something there to do in a therapeutic way directly with your practice. So I just appreciate you for your not just your time today, but also your helping thousands of people come to a fuller expression of who they are.
Thanks, Michael, for being with me and seeing me that way.
Yeah, I sure do. Just appreciate our ongoing connection over these many years. And just, you're a great light in the world. You bring great wisdom and inspiration and guidance and to so many. So I just appreciate you and for your ongoing evolution in not only yourself, but in how that evolves, the contributions you make in the world.
And take care, Michael.
Thank you. David Camden, sir, thanks for the time today and for your ongoing blessing that you offer to so many. Well, excellent. Thank you all for being here today. Please go to davidkamnesser.com and Dr. Davidkamnesser.com to connect with David's work, his book, and just the many offerings that he has that are such a bright, clear light in the world. So thanks everybody for being here today. We have a wonderful special guest as well next week, Donnie Yance, very much a kindred spirit. He's going to be with us next week. He's contributed much in the realm of herbal medicine and many other areas. He and I have a great connection, both being Italian and musicians and herbalists and seeking to bring greater light in the world as well. So please join us next week. Many thanks to all of you who have helped support this show. And I'll give you again the link you can share with folks who are in your life. And if you'd like to make a contribution to helping us keep these shows going week to week, you can certainly do that. And just to share this page, the Mondays with Michael page, with those in your life who you'd like to share that with. So we can have great conversations like we did ongoingly with folks like Dr. David Kamnesser. I appreciate that. And you can also support the show by taking a course in our school. We have 59 courses in our school with 23 faculty, actually 25 faculty now. I have to remember the new faculty count. Come take a course, and really encourage you to take the course that begins today, which is Build Your Winter Ready Immune System, and also to prevent COVAX carnage, as I not affectionately refer to, just the total, insult that has been to the human body mind from these COVID injections. And I'm very happy to report there's just a lot we can do to help provide real assistance to people in preventing injury, but also helping address any current issues that have come up for folks who have received these super toxic injections. There's a lot of life that can be brought to bear. So here's our show page, michaelgaeta.com/MWM. Coming up next week, the great Donnie Yance, wonderful herbalist and more. And then the following week, a local filmmaker here in Boulder is doing amazing work of bringing meditation and healing into the prison system, seeing prisons as places for growth and awakening and rehabilitation and coming to a deeper sense of self. That'll be in 2 weeks with a wonderful Tibetan Buddhist practitioner and teacher. She's also a professional astrologer, though we're not going to get into that too much in that show. We'll do a separate show on that. So we have some great shows coming up, and others. We have many others who we're just looking to schedule with everybody's busy schedules to get them into the show schedule. Looking forward to that. And this show will be available by the end of the day on our watch page. So you just go to michaelgaeta.com/watch. This conversation with the great Dr. David Kamnesser and an archive of all of our past shows, well, not all, but a whole lot of our past shows are going to be right here by the end of the day on our watch page, where you'll be able to share an individual show or just share the page or whatever you like, that'll all be available by the end of the day. So michaelgaeta.com/watch to share this show, and about 175 of our past shows are all here on this page. So there's that. And again, really recommend you join us today, later today for a new course. It's a 3-week course that's brand new, and it's going to have some amazing information that'll be able to help anyone, whether they've been injection injured or they just want to have a healthy immune system. And please use your discount code for all of our courses, with my appreciation for your being here on the show. MWM10 gets you a tuition discount on all of our courses, which is an exclusive thing just for folks who join us on the podcast week to week. And finally, you can also help support yourself, your own thriving and well-being, just having at least an annual consult here in the clinic to do a lab review and lifestyle reset. That is all available through the clinic. And you can just go to michaelgaeta.com, and you can go to clinic and then patients, and you can schedule a free consultation to see if it's a good fit for you, or your initial evaluation, or just a follow-up. I do recommend folks have at least an annual checkup, so to speak, just to see how you're doing and come up with some practical next steps. You'll find all that at michaelgaeta.com, or you can go direct to the patients page, just going /patients, michaelgaeta.com/patients. So thanks everybody for being here today. We have just so appreciate Dr. Kamnesser for his just deep heart and wisdom, and sharing so much of that with us today. We're going to close. We've kind of finished our time. We're going to close with some piano music for those who want to stick around. Otherwise, we will see you all next week with the great herbalist and more, Donnie Yance. And he and I are looking forward someday to making music together. He plays the bass, and I'm going to play the piano for you here today. And many blessings to you and yours. Thanks for your attention and time being with us today. Take care. Okay. This is an original called Lullaby. Okay, well, thanks everybody. So good to be with you today. Bentley wanted to say goodbye before we sign off. And also, if you want to hear some more piano music, just go to the website under Watch and click on Video Library, and you'll find lots of piano music there, including that original piece called Lullaby on our video page, and you'll see that in the piano section. So thanks, everybody. Blessings to all.